This is Radio Health Journal. I'm Nancy Benson. This week, 1 in 20 women are affected by preeclampsia during pregnancy.
Women have proteins, but these proteins have a misfolded shape to them. And because of this misfolded shape, they're actually able to attach to Congo red dye.
And that's the basis of a new way to diagnose the disorder when Radio Health Journal continues.
I'm Reed Pence, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This week on Viewpoints.
What does it mean if we lose all the coral reefs? What does it mean when major forests start to go away? What does it actually mean to other species as well as our own when we lose glaciers?
Bearing witness to the end of ice. Then,
her life gives us a view of history that is really, really rare.
The Extraordinary Life of Mrs. Adams. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
Preeclampsia affects 5 to 8% of pregnancies globally and is the leading cause for premature delivery. Experts say that each year it results in nearly 1 in 5 maternal deaths in the U.S. But despite its prevalence, little is known about exactly what causes the disorder and how to treat it.
Preeclampsia is a condition that occurs in pregnancy or the immediate postpartum period, and it has to do with improper functioning of the placenta that is characterized by elevated blood pressures and protein in the urine or other vague symptoms and laboratory values that suggest that it has affected someone's other organs like the kidneys and the liver.
That's Dr. Kara Rood, a maternal and fetal medicine specialist at the Ohio State University Wexner Medical Center. While the exact cause of preeclampsia is still unknown, doctors believe it's tied to blood vessel deficits in the placenta, the organ which feeds the fetus during pregnancy. Limited blood supply in the placenta can lead to inadequate blood, oxygen, and nutrients for the baby, and potentially fatal complications for the mother. Preeclampsia typically presents in the second trimester after the 20th week of pregnancy and is difficult to foresee and diagnose. In some rare cases, it can develop or continue postpartum for up to 6 weeks.
It's hard to completely predict who's going to develop preeclampsia, but women who this is their first pregnancy, women with a history of chronic hypertension or have had preeclampsia in a prior pregnancy, also ones that carry twins or higher order multiples like triplets are at an increased risk. Some of the more general symptoms that women report are not feeling well, nausea and vomiting, swelling, headaches, which all of these can also be symptoms of pregnancy. And sometimes that makes it a little bit hard to discern whether this is preeclampsia or not, just based on the women's symptoms.
There is no cure for preeclampsia. However, Rood says awareness of a diagnosis can help in monitoring and preventing the complications associated with it. The disorder also has varying degrees of severity, with more serious cases leading to full-blown eclampsia or seizures that may lead to a coma. To head that off, sometimes the only solution is to force an early delivery, resulting in possible complications to the newborn, including blindness, cerebral palsy, and developmental and learning disabilities.
Secondary to the elevated blood pressures, they can get so high that women can stroke out. They can progress to something called an eclamptic seizure that doesn't resolve, and both of these can ultimately result in maternal mortality and significant morbidity. It's very hard to predict how fast it will progress into the severity that the disease will affect someone. Some women get it and go on to deliver a term infant, whereas other women get it and it becomes so devastating it results in early preterm deliveries and sometimes stillbirth or deliveries that occur so early that the baby is unable to survive in the outside world. We try to expectantly manage it with increased surveillance, more appointments, monitoring blood pressure, monitoring the growth of the baby, monitoring how the baby's doing inside the uterus are all things that we do in hopes that we can push the pregnancy to a more favorable age and when the baby will do better outside of the uterus.
About 1 in 20 expectant women develop preeclampsia. Since many of its symptoms imitate common aches of pregnancy, like nausea, swelling, and headaches, the average person wouldn't know if they have preeclampsia until seeking out medical help. This leads many women to delay care until symptoms are severe, and they're forced ahead to immediate care. In fact, some women with preeclampsia do not display any symptoms or pain at all until the disorder has progressed into full-blown eclampsia. To help make a diagnosis more accessible, Dr. Rood has developed a simple, non-invasive urine test that can uncover whether a woman has preeclampsia in a mere matter of minutes.
Women who have preeclampsia in their urine are proteins, but these proteins have a misfolded shape to them. And because of this misfolded shape, they're actually able to attach to Congo red dye.
According to Dr. Rood, the test is 98% accurate and should be on the market within the next 2 to 3 years, pending FDA approval. She has high hopes that this new test will be readily available for OBGYNs nationwide and for widespread at-home use during pregnancy. While there is still little that can be done after diagnosis, bringing awareness to mothers is key to monitoring the disorder and having a healthy delivery. Regardless, the test opens up other avenues for possible treatments down the line.
There's still ongoing studies looking at these misfolded proteins and possible target for interventions and therapeutics down the road. So this is the first step and hopefully many steps to eventually discover a cure rather than just a diagnostic test for this disease.
There is still much work to be done in the treatment, cure, and prevention of preeclampsia. However, this test may be the key to early diagnosis and management, preventing the dangerous late stages of the disorder leading to possible long-term effects for both mom and baby. You can find out more about preeclampsia on the Preeclampsia Foundation website at preeclampsia.org. You can find out more about all of our guests on our website, radiohealthjournal.net, and also find archives of all our programs, as well as on iTunes and Stitcher. Our writer this week is Amira Zaveri. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
May is American Stroke Month, and while not all strokes can be prevented, up to 80%, including recurrent strokes, may be, with a few changes, like not smoking, eating healthfully, being physically active, and maintaining a healthy weight. People who've survived one stroke are at a higher risk of having another, according to Dr. Mitchell Elkind of Columbia University.
About 1 in every 4 stroke survivors will have another one. The best way to reduce your stroke risk is to live a healthy lifestyle and work with your doctor on a prevention plan. Also, ask your doctor if a daily aspirin or other medications for secondary stroke prevention are right for you.
More than 116 million people in the U.S. have high blood pressure, and fewer than half have it under control, putting them at increased stroke risk. Nothing causes more strokes than uncontrolled high blood pressure. Learn more at strokeassociation.org/stroke month.
You might be surprised to learn that among all developed countries, the United States has the highest rate of maternal mortality, and that the rate increased 56% between 1990 and 2015. More women are giving birth in their late 30s and 40s, and rising rates of obesity, diabetes, and high blood pressure also increase maternal risk. That's why Dr. McCallum Hoyt, chair of the American Society of Anesthesiologists Committee on Obstetric Anesthesia, says having a plan is important.
Expectant mothers, especially those with underlying health issues, should talk to their obstetrician and physician anesthesiologist during their pregnancy to develop an optimal labor, delivery, and recovery plan. Let them know if you have any fears. And most of all, take care of yourself. Overall health, certain health issues, and even multiple cesarean deliveries can affect maternal safety.
Physician anesthesiologists are leading the way to develop protocols that improve safety as well as pain management during and after childbirth. Find out more at asahq.org/whensecondscount.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free, and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.